The coronavirus surge in the U.S. is hitting historic highs. More than 250,000 new cases were reported in America over the weekend. The 7-day average for the U.S. is now at more than 78,000. This is up 128% from September's low. The U.S. now sits at more than 9.2 million cases. This surge is happening in 44 states, but at least 3 of them are Midwest battleground states where President Trump and Democratic challenger Joe Biden are campaigning hard. CBSN News' Adriana Diaz has more.
It's the final push before Election Day in Wisconsin, a state all too familiar with political division. One key point of contention this year, the country's coronavirus response.
This has affected this community in very, very profound ways. We've lost a lot of good people.
Dr. Manar Al-Shahuri treats COVID patients at 2 Green Bay, Wisconsin hospitals, both of which are near capacity. He's concerned about making progress against the virus, saying public health policy has become political.
We are flaunting masking. We're debating basic, effective measures. I know this is a very emotive topic, but just stop. Look at the data. Look around you.
A New York Times analysis looked at the top 20 metro areas with the greatest number of new cases relative to population, and 10 were in Wisconsin.
In 2 months, our 7-day average has increased by more than 500%.
Democratic Governor Tony Evers says he's not considering another lockdown. The state's Republican-led legislature has challenged his previous public health orders.
Honest to God, it's just breathtaking. We're in a very difficult situation here. We should be pulling together instead of pushing apart.
Another concern for the Midwest, dropping temperatures, forcing people indoors, especially during upcoming holiday gatherings. Former FDA Commissioner Scott Gottlieb spoke on Face the Nation.
My view is the inflection point is going to be Thanksgiving. I think it's going to be unmistakable what's happening at that point.
The U.S. could potentially hit a sobering and scary milestone this week, a daily record of more than 100,000 cases. On Friday, we hit 99,300 cases, which was the biggest single-day increase we've seen so far. And at least 14 states have broken their own single-day records in the past 3 days. Adriana Diaz, CBS News, Milwaukee.
I want to bring in Dr. Heather Yo now from New York City. She's a medical advisor to SurvivorNet and a professor of surgery at Cornell University. Dr. Yo, welcome. Thank you for being with us. October has been a rough month in regard to the virus. Experts say, however, this isn't even the worst of it. Can you tell us what the medical field is anticipating this winter?
Yeah, I live in New York when we were really hit quite hard early on in the pandemic, and we're all worried. I mean, we know that there's a very likely chance that we've all seen that the numbers are going up. What we're trying to do to prepare is make sure as many patients as can get vaccinated in advance. We're also trying to make sure that we have the resources available that we need to be prepared for another second surge.
And so when you say get vaccinated, you mean obviously the flu vaccine?
Correct. We want our patients to have as much protection as they can as we're going into this. As providers, we're very worried that there might be difficulty understanding whether someone has the flu or whether or not they have something else, anything, the cold, all start with very similar symptoms. And while we know coronavirus is much more likely to get very serious, we want to make sure that our patients are as prepared as they can be.
So, Doctor, Europe is experiencing a strong surge right now, yet the U.S. is largely outpacing most of the continent. When the first wave sort of, traveled around the globe, we were a couple months behind Europe. Could we see an even worse surge here based on what's going on over there?
I think there's no question that our numbers are going up, and I think experts around the country, for example, Dr. Fauci, have said, we see the numbers going up. We know that we aren't really doing what we need to as a country to do the very simple things that we should be doing. We should be wearing masks. We should be social distancing. We should be washing our hands, very common measures. And as mentioned earlier in the segment, we're very worried as people are forced more and more indoors, there's going to be more opportunity for virus spread.
So talk to us about the delay in hospitalizations and deaths, because we hear these numbers going up in terms of infections, and they sound very dramatic. Are hospitalizations behind that a little bit and deaths even further? Or are we better positioned this time around to keep the hospitalization rate lower and the death rate hopefully lower as well?
I mean, I think it's a combination of things. We definitely do understand the disease a little bit better. I think that we are able to test more, so we are picking up some more quiet cases, but those are important because that will help us to curb the spread. But I do think that there's definitely going to be a delay in the sicker patients. We still at hospitals are seeing sick patients that are needing intubation, that are dying. But there's definitely a delay. We know that the disease starts out much like the common cold, and then patients actually, their sickest time tends to be in the second and third week. And then patients can remain under treatment for long periods of time. So I think it's a combination of factors, but I do think we are more prepared and we do understand the disease a little bit better now than we did in March.
Okay, so for all of us who want to get prepared for the winter and the potential of being exposed to more, cases of coronavirus, and some people haven't had the chance to get the flu shot yet, or perhaps they are scared to get the flu shot, but they're doing everything else. They're wearing masks, they're socially distancing, they're washing their hands. Are there any supplements or alternative options people can use to keep their immune systems up?
I think that there's very little evidence around a lot of herbal supplements. We do know that most people are low in vitamin D. That's something we get often outside when we see the sunshine. But taking a vitamin D supplement can be helpful. We also know that vitamin C is often helpful for individuals. But really, very little other supplementation has any direct evidence. I think that there are some things that we know that individuals can do. Exercise is really important. Getting enough sleep is really important. And mental health is really an important component of our immune systems. And so for people focusing on their mental health in this very difficult time where a lot of people are kind of tired of being indoors is important. Going outside and fresh air is really important. Those are kind of the things that we can try and do to kind of keep us ready.
All right. Well, Dr. Yo, thank you so much for sharing your expertise with us. We all need to be on our guard going into the winter. Thanks so much.
Thanks for having me.